So in our last video, we talked about this TikTok that's been circulating about non-surgical breast augmentations. I feel like we get a lot of patients that come in that want fat transfer, that want different things in everything except for an implant, it seems like. Why? What's your impression? Like, what do you think is happening? Why is that?
Well, I think first of all, we live in a time which I think is good, where people are looking for natural, sort of organic solutions. Women who are looking for fat transfers, I somewhat understand that. It's their own tissue. It'll last forever if it works. And
Right.
I mean, but there are issues with that that patients don't recognize, that how much is going to survive, and do they have enough donor site? So yes, I can understand that. I couldn't understand the issue with sculpture, but I guess your question, to go back to your question, sort of went off on a tangent there, folks. Without a lot of scientific data, silicone implants were sort of off the market for a while.
Oh, I didn't know that.
And we had salines, and they came back. Yes, we know there are documented illnesses and documented even, tumors associated with implants, but the incidence of that is extremely small. And if you try to compare that with, like, what we heard in the last video, sculpture injections,
risks are higher, I would say, for that. At the end of the day, like, doing a breast augmentation with implants doesn't have to be as big of a deal as it makes it seem like online.
The actual risk profile is quite small. And for people who are curious, they have like 25-page descriptions of the risks associated with implants on each of the manufacturer's websites. I don't think the clinic that's doing the injections of sculpture in the breast has a 25-page statement on their website of the risk, because nobody has studied it. And I think it's probably has a lot of risks to it.
Yeah, definitely.